Okay, so for those people that don't know, what is it about cannabis that helps children with epilepsy? What is it in that plant that works?
Well, there's a whole array of phytocannabinoids in there. So everyone's familiar with THC, everyone's familiar with CBD, you've probably seen it down at Holland and Barrett's, and these are the ones that everyone really knows about. But there are so many more, there's hundreds more. You've got CBG, CBC, and these all work together with what is known as the entourage effect. And then we've got the terpenes that come along as well. So we've got those beautiful smelling compounds in there, and these all work together to actually help to treat symptoms. I use cannabis myself to treat my epilepsy and find that it helps with sleep, and getting sleep is a #1 priority when you have epilepsy.
And it reduces seizures considerably. Like, how effective is it for you?
For me personally, yes, it's exceedingly effective. I know when I've not had it, so when I miss the medication is when I will see that my stress levels will go up, my anxiety will go up as well, my sleep will be reduced, and then I'll increase the risk of a seizure and one being triggered. For Matt and Hannah, they can definitely tell you how it improves their life for their children.
Tell us, because your children are obviously young.
Yep.
So they can't necessarily tell you how they're feeling and how they are, and you have to observe and understand how to look after them. How effective has it been in your life?
So Charlie was suffering up to 120 seizures per day, and then once we introduced cannabis, that reduced down to 20, and that's been maintained for 2 years now. So again, you have bad days and good days, but predominantly it's around 20 to 30 seizures per day. So that's an 85% decrease, which is massive.
And I know a lot of people that hear it just imagine a child with a spliff, really, don't they? They don't really understand how that is administered. What is it?
It's an oil. So it's just an ordinary oil, sublingually, so through under his tongue, or just in his mouth. And it just swallows it, and that's fine. Yeah, that's it. That's 3 times a day, and that's it.
Okay. I think it's really important to remember that this is just a medicine like any other medicine that our children takes for, anti-seizure. So my son still continues to take anti-seizure medication alongside cannabis. But what we've seen in Alfie, before he used cannabis as a medicine, he was having up to 150 very severe seizures in a cluster a week. In 2016, for example, we were in hospital 48 times in 1 year, which is pretty much every week. He had absolutely no quality of life due to the high amount of drugs that he needed intravenously to stop his seizures. And with cannabis, his condition is very rare, and it's called PCDH19, and it does cause very severe seizures, but you can have periods of no seizures. And Alfie's had, with cannabis, 530 days today with no seizures, which is massive improvement in his quality of life, but also in mine. And something that's really important to me is the social impact on families where you have a child with uncontrolled seizures. It's huge. It's huge on the mental health of the parents. There is very little support from the NHS for mental health of parents who find out their children has long-term chronic illness. And
what is the advice? Do they give you any?
We were told it's very sporadic, and we were told, for example, with Alfie, that on Christmas Eve, that he had a condition called PCDH19, which causes very severe seizures, mild to severe learning delay, can cause psychosis and other severe mental health problems in adulthood, and that there was no treatment. Why were we told on Christmas Eve when there was nothing that could be done for him? My experience, individually has been amazing in the NHS, for example, with some of the nurses and doctors that, we wouldn't be here without their support. But officially, we never really had any long-term mental health support. We never had any long-term respite, and that's something that is not unique to my family. It happens to many families across, with all these children with epilepsy, and that's really, really sad, because actually dealing with a child with epilepsy is very severe, very all-consuming, a big change to your whole family dynamic, and that's why this medicine should be available to people who need it, because it can change lives. I'm able to now work, and that's really good for my mental health, to be able to work and not to be a full-time carer to my son. And my son, most importantly, can go to school every day.
So you have access. So why don't the majority of people have access to this medicine? What is going on?
Basically, it's guidance. Guidance is really restrictive. So you have the NICE guidance, which all hospital trusts will refer to, and clinicians. That isn't very forthcoming. There has been new clarification, which a legal challenge between Hannah and myself, against NICE, which
And NICE are?
the National Institute of Care and Health Excellence.
Okay.
So they're a government agency. They oversee all medicines that are prescribed on the NHS. You then also have the British Paediatric Neurology Association. So they are made up of all the paediatric neurologists within the NHS and private sector. And they've actually reintroduced some new guidance which came out in the last week. And that's even further restrictive. So clinicians need to be very, very bold to want to prescribe cannabis because they're on their own. They've got no support from the BPNA.
So they can get struck off if they
not struck off.
So what's the worst that can happen? Like, what's the pressure?
It's about not being seen to be doing the right thing clinically by your peers. We do know recently the BPNA reported a doctor to the GMC who was prescribing because they felt he wasn't doing it in the right way. The GMC actually recently reported on that and said that there was no case to answer and that the doctor in question actually was doing the right thing, and actually that they felt the BPNA's stance was actually doing more harm to children than good. And I think the BPNA are calling for what's called randomised controlled trials, which is where you look at the single compounds of the cannabis plant in trials, which cost many millions of pounds. And actually, what we do know is that many drugs that are given to children already on the NHS do not have that sort of robust evidence of safety, but yet they are still prescribed based on what's called historical data. So that means that a doctor has, or doctors have used it in the adult population and may see that it's okay to use in the children population, but they don't actually have that robust data behind it. So we don't understand why cannabis is being treated so differently, because actually it can be life-changing, and what we'd like to see more.
Do you honestly not understand why it's being treated differently? Like, can you?
Well, I know that, for example, the BPNA have been involved in running trials, for example, for these pharmaceutical products. So obviously they believe that's the route for the NHS. But I don't understand why it's being treated so differently, really, when actually what they are doing is causing harm, as far as I'm concerned. People will use cannabis anyway. We know that in Medcan Support, Matt and I and Callie started Medcan Support because when I went to Holland with my son in 2017, I knew no one with a child with epilepsy. I knew no one who was using cannabis other than my friend Vera Toomey, who's in Ireland. I felt very isolated, and we don't want families to feel like that. We want them to have the information. We want them to have the support available to them so they don't feel alone. But what we are seeing is people using products from the black market because they can't get access through their clinicians. And that's something, again, I don't understand why we're seeing doctors basically pushing families to the black market with their advice. That's very, very sad. And what the final point I'd make is that when the law changed, we have one of the most liberal legislations in this country throughout the whole of Europe for prescribing cannabis. So cannabis can be prescribed by a specialist for any indication that they believe it should be there for. So if they think there's enough evidence, they can prescribe it.
So what's the problem?
So the problem is the governing bodies such as the BPNA, NICE, the Royal College of Physicians.
Sort of shame. It's like a
they're
shaming
saying that there isn't enough evidence. So you've got to be a very brave doctor to stand up and say, this is the right thing to do for my patient. And also the funding mechanism isn't there. So because these medicines aren't approved by NICE because they say there's a lack of evidence, that there is not a clear funding pathway. So it is very, very difficult for doctors, but I also think there's not enough doctors doing the right thing here and standing up for their patients.
Going back to the evidence as well, it's randomised controlled trials are only designed for single pharmaceutical compounds. Cannabis has an array of compounds, so in all the oils that we're using, there could be, there are hundreds of active compounds that are working within our bodies. So the randomised control trial isn't going to be able to give us the answers. And in fact, the questions that they're asking about long-term use, a randomised control trial wouldn't give them that information anyway.
Right.
It's real-world evidence that's going to give them long-term evidence,
Right,
which is what we have in our children. Alfie's been on it for numerous years. Charlie's been on it.
The evidence is there.
So we have the evidence.
We do,
and it's
have
well
evidence.
documented, isn't it?
Yeah, and I think also as well, some people say, well, as long as you standardise a medicine, you could randomise control it. But actually, when you're looking at what would be called in umbrella terms a whole plant extract, that doesn't mean it's a like for like. The plant is the plant. When you extract, 7 or 8 compounds, that is what's called a whole plant product. that can never be standardised if you're going to do it as a true plant extract. It's always going to be slightly different. So every time a company grows a strain, depending on the light, depending on the way the soil that they use or the growing compound that they use, it's always going to be slightly different. But that's not a bad thing. Again, we've got this pharmaceutical mindset that every medicine has to be the same, batch to batch consistent, it has to be the same. But that's fine in a single compound product. But in a botanical, it's not needed. I've never seen any problems with Alfie having slight different batch to batch changes on his product. Actually, it's good for the endocannabinoid system because it's not getting used to what you're giving it. So you're getting a better effect in my experience.
Yeah. That's really interesting.
Different medicine.
Yeah, exactly. It should be explored.
Yeah.
It's a natural plant. It's been used for hundreds of, or maybe thousands of years as a medicine. So there's just legislation that's come in and stopped that.
And I think it's that stigma still around cannabis. There's a huge stigma around cannabis. As you know, we saw in the 1930s in America this really big drive against cannabis. It was a very racist campaign against people who use cannabis. And actually that was because of the advent of pharmaceuticals. So up until that point, cannabis was a well-used, well-tolerated, well-accepted medicine. It's just we've had this real drive against cannabis, and that's again what's coming through with these doctors is this stigma and lack of understanding, because they're not trained in botanical medicines. They're trained in the use of pharmaceuticals as symptom suppressors, and that's what we've got to work on, is that mindset of changing people's attitudes, because I think the public are one in that sense. The public believe in cannabis as medicine. I think it's very much the professionals that don't still.
How many children in the country are suffering with this?
So 60,000 children have epilepsy in the UK, and a third of them have what's called refractory epilepsy. That's where pharmaceuticals don't work. So like Alfie and Charlie, they'll still continue to suffer seizures. So Charlie was on 4 anti-epileptics and still suffering 120 seizures per day. So there's approximately 20,000 children in the UK with refractory epilepsy.
And then you've got the extended family that are dealing with it.
Yeah,
and the impacts it has on
exactly. And therefore the parents can't work, so they can't pay their taxes. I remember, you know, when I was a full-time carer to my son, just wanting to take him to school, just wanting to be like any other mother walking past my house, taking the children to school. I couldn't go out. I couldn't, you know, I was so isolated and in so much grief. And that's happening to these 20,000 families, and they're not getting enough support, sadly. They're not getting the respite they need. They're not getting the mental health support that they need. And actually, if you get down to basics, if you gave those 20,000 children the chance to use cannabinoid medicines, that would save the NHS millions of pounds. You know, when we were looking to get Alfie's licence, we worked out that we were going to be saving the NHS up to £150,000 just for him, not going into hospital a year, not going into hospital every week, not needing ambulance, not needing intensive care beds, things like that. And, you know, so it makes sense for the NHS just to use it for that reason alone. You know?
And when you show this evidence and when you do the number crunching, what is the response?
Well, obviously for us, we managed to get Alfie's prescription. What we are doing and we're working on with drug science at the moment is to produce a health economic report, because a health economic report is really important to show actually that we could introduce cannabis to the NHS at net. We believe it at net zero. You know, we don't think it's actually going to cost the NHS any money, because the reduction in opioid prescriptions, for example, with pain patients and the intensive care beds for children like Alfie and Charlie, there's going to be a lot of money actually saved, because cannabis can be very expensive if it's imported from other countries. And again, that's why it's really important to talk about the domestic sector as well.
It is grown here.
No, other than GW Pharmaceuticals, no, it's not. There are licences being given now, but no, we don't have a UK domestic sector growing cannabis. And that's another thing that's really, really important for the government to understand, that the value that actually having a UK sector can bring to the economy, to jobs, to the supply chain. We've seen a real problem with the supply chain during COVID, where people have had gaps in their treatment, which is just unacceptable and not seen in other medicines. So there is it's really important to have a UK sector, you know, for the benefit. We should be, you know, bringing in products from other countries, but actually why aren't we making the best of this for our own country and for jobs and for the economy? So that's one thing the government are missing at the moment as well.
So why did you set up Medcan Support, and what do you actually do? I think you just do loads of things, don't you? I mean,
too much.
Too much.
We basically set it up, as Hannah mentioned earlier. When we started using or researching cannabis, we had nowhere to go, we had no one to turn to. So I was kind of lucky because I had Hannah, and she is already a little bit down the road. But so we were both just trawling the internet on various different sites, you know, or in the US and Canada, etc. The legislation over there is different to here. So it was just, Medcan's a central hub for education. It's there for parents like us and patients, where they can just go to one place and all the information is there. So it's, you know, regarding clinics, research, education, talking about cannabis, talking about the endocannabinoid system. We have webinars from various clinicians all over the world that have been prescribing cannabis for many, many years. So it's just trying to be that hub for information.
And we're going to, now we've got charity status, we're going to start raising money to support families with mental health support, but also things like short breaks, stuff like that, because we didn't get any help at all respite-wise until Alfie was 6. It seems to be that you have to get to a certain age, I think it's about 5, where your child is still disabled, that you will then start getting something that's called direct payments, where you get respite. But that's very, very difficult to get. It's always a fight.
And it's after 6 years of hell.
Yes, basically. So the only reason I think I survived what I went through with my son is because of my parents, because of my family, because of my mum, because of my partner's mother, who helped us, and because of my sister-in-law, who, my sister-in-law sometimes used to sleep the night in hospital with Alfie, so Drew and I could just go home and be together. And you know, we wouldn't have survived that. Not everyone's got that. So Matt and I and Kelly feel very strongly that Medcan needs to be supporting these families. So if they want to seek mental health support, we can pay for some sessions for them, or if they want to have a short break with their family, or if they want to pay someone to just look after their child for a couple of hours so they can go out for dinner. It's the basic things, isn't it, Matt, that you lose when you've got a child that's very poorly, that, you know, everyone takes for granted, where they can, you know, once their child gets a bit older, they can start going out for dinner again with friends and things like that. You just can't do that when you've got a chronically ill child. So we're very passionate about raising money and supporting our families as much as we can. So we're really starting, you know, to push that as well now. Because we never had that, you know. When you were told about Charlie, you were told in a corridor, weren't you, as well?
Yeah,
you know?
we were told in the corridor. We knew that had epilepsy. But we were told in the corridor, just handed a leaflet, but it actually said that he could die before he's 10, and the percentage rate of that happening. So to be left in the corridor with no one there to tell you that your newborn child is,
And again, I think that's just, you know, it's not putting the blame at the doctor's doors, it's lack of funding for the NHS. They don't have the funding or the resources necessarily for providing that support. So there is a big gap in supporting families like ours. So we want to do something about that.
And what are you doing about it? Have you got things coming up?
Yes, so we've got a Parliament event. So we've organised an event to basically, what we said here is show them the research of drug science.
And if you're talking facts, and you're talking figures with them, it's their language as well. They'll be more susceptible to hearing about
the evidence and talking about why real-world evidence is so strong and so needed versus randomised controlled trials. And it's trying to push that message across to MPs. And they're the people that can bring change.
That can put the pressure on NICE as well, because at the moment NICE have only assessed what the randomised controlled trial evidence, and actually there's loads and loads of evidence. If you go on PubMed, for example, there's over 25,000 citations in cannabis, whereas when, for example, I remember seeing a talk with a doctor in Canada when statins were made available on the NHS, there was only 5,000 citations on PubMed, and yet they were available as a licensed medicine. Cannabis, there's so many research studies that actually NICE could draw on. They even dismissed, for example, studies that have been done in a foreign language. They didn't just get them, transcribed. They just dismissed them. So, you know, we need to change that narrative from NICE. We need to get them to look at this real-world evidence, to see that it's robust, to see that it matters. And as you say, Drug Science have collected all this data from the families from the End Our Pain campaign and Medcan Support. And, you know, it matters. And it's real. And I remember speaking to a doctor once from Canada that I was doing a radio show with, and he said, if you have a child who's got hundreds of seizures and then they stop happening because they take cannabis, that is evidence.
Yes, of course, you know, it is. Yeah.
It's got, and that's what made me move on to cannabis. I was talking to lots of people in America and Canada, and they were all saying the same thing. And it can't be dismissed as anecdote. It is fact. It does help people in varying degrees. You know, my son's life has completely changed because of it, and so has Charlie's, and obviously Callie as well. You know, it's changed Callie's life. So, you know, it's really, really important to all of us that we can make change through the work with Medcan Support. And obviously, we're very, very grateful that you've agreed to be the ambassador for Medcan as well. That really, really means the world to us and brings a new dimension to what we're doing. So, you know, that's what we're doing as well.
I think one of the big problems as well as what you mentioned is the lack of education. So when I did my degree in biomedical sciences, all you learnt about cannabis was how to detect it if somebody had been driving. And that was it. There was nothing about the endocannabinoid system whatsoever. So a lot of these doctors you're going to, and they're looking going, cannabis, well, that's just for getting high. Yeah. That stigma needs removing, and they need the education on what the endocannabinoid system is. We've all got one. Yeah. Why is this not taught? Why are they? So I sympathise with the doctors of why they're scared to actually prescribe when it's not something they know much about. Yeah. So you would be, a little bit apprehensive to prescribe something and lose your licence when you've spent 7 years studying this. You'd be very apprehensive. And there's a little bit of academic snobbery. I'm glad you brought it up about different papers. In the academic world, for some reason, the actual papers published in the UK of greater status, we'll call it, than papers that are published in a different country. And there's this kind of snobbery that goes off. So we're trying to break those barriers down as well, so that parents, patients can ask the questions to the doctors and make them do their own research as well, get them curious about it. My neurologist, when I've gone to her and said that I've obviously got a prescription, she was very sort of nervous and a bit, what's this about? Can you send me more information? She wasn't willing to prescribe, but she was very much, I want to know more about this.
That's really good. That's really positive. And I think that's all we can ask of doctors is just not to dismiss it. Just be interested, explore it, think about why you became a doctor, why is what your patients are at the centre of what you do. And that's, again, something I always think about. People become paediatric neurologists surely because they care about children. And I've spent a lot of time in hospital. I know how many children are in there having a lot of uncontrolled seizures. I don't know if they become sort of distant from it because they see it every day, that they don't understand what it's like for those families, but surely they should be doing everything in their power to reduce harm, to stop people using black market products, and actually to clinically make this product available. And for example, they keep saying, we're going to bring a trial. Well, that's not happening. And it's urgent. The law has changed for 3 years and there's still no trial in CBD and THC. That's not urgent. That's just grossly unacceptable, and people are still suffering. And I just think, if my son has, quite severe learning difficulties, and which have improved since his seizures have stopped. But if I could have given him cannabis when he first started having seizures, who would he be now? I don't know, because he's had so many unlicensed drugs. He's been on life support machine so many times that it does sadden me. And I just think we have a duty of care to the future, to the other children that are going to come into this world who have epilepsy, to ensure that this medicine is available to them. And surely doctors should feel the same. And
can I just ask, is Medcan just you 3 people sitting here today?
Yes.
Oh my gosh.
Yes.
Yeah.
And I would say it's very much Matt as well runs it.
But you are incredible human beings, aren't you? But you need an army, don't you, really? And you need to generate money and awareness and to help make those changes.
Yeah, definitely.
Well, I'm with you all the way, guys.
Thank you. Thank you so much for your support.